My name is Kalpin. I'm a registered massage therapist and I've been practicing in Ontario since 1984. I hear many therapists say that they feel emotionally stressed by their clients' troubles, by their clients' negativity. And some people even say that they feel emotionally burnt out and not able to continue in the profession. So that's what we're going to be talking about in this short course, and I'm going to discuss this in 4 short chapters. So in this first chapter, I'm going to discuss when clients talk about negative things during their treatment. First of all, why do clients do this? What do they talk about and why do they talk about it? First thing that clients may talk about when they're on the table is their pain, their problems that brought them to massage therapy. In a way, we've kind of asked for that because during our interview, during our health history and our interview, we asked the clients about their problems and their pain. So for some people, it seems like a natural thing to keep talking about this while they're on the table. Sometimes that's actually helpful because we find out things more about their problems when they're on the table than they may have told us during the interview and assessment. But sometimes therapists can find it stressful when the client is complaining throughout the whole hour of the massage. There are some things we can do. We're often advised in school to tell the client that they can be quiet and they can breathe and listen to the music, and sometimes that works. But some clients really need to keep talking about their problems and about their pain. So what can we do with that? Well, we can use that information to give the client helpful advice, to give them advice about home care, about self-care, about how they can manage their problem, how they can manage their pain. We may be able to give them referrals to other therapists or to other modalities that might help them. So we can use that to our advantage, our therapeutic advantage. Another aspect of why clients may spend a lot of time or maybe the whole time on the table talking about their condition, their problems, and their pain is that sometimes they really don't have anyone listening to them. They go to their doctor, they tell the doctor about their immediate problem. The doctor may give them 5 minutes of time, give them a prescription, and send them out the door. They don't have a chance to talk about how this problem is actually affecting their life. Co-workers, friends may get really tired of hearing their complaints. They may not want to listen to it. They may not believe them that they're really having that much pain or that much problem. Same with family. Family members can get very tired of hearing somebody complain about their pain. So the massage therapist is one person who will listen. And since we are in that room, often for an hour, that's their opportunity to be heard, to have somebody who they perceive as a caring person listen to them. And so that is a role that we're fulfilling. What do they want us to do about this? Usually, they don't need us to do anything about it. We are doing our best for them with our massage therapy, but as for how this problem is affecting their lives, we give them our home care advice, and other than that, they really don't have expectations. They just want someone to listen. So we don't have to take this on as being something that we have to fix. We don't have to fix it. There is no expectation that we're going to fix their lives. We are just a sympathetic listener. And if you can accept that and just let it go, then as a therapist, you don't need to take on the stress of hearing about those problems. What other negative talk might you hear? Well, people will tell their massage therapists all kinds of things. They'll talk about their stresses at work, their stresses at home with marital problems, or problems with their children or their aging parents, whatever is troubling them. Again, some therapists feel that they need to fix the client's life, and we don't. We just need to be sympathetic listeners. So we hear all this. If we can give practical advice, if we can refer the client to an agency that might help them, if we can, if it's a marital problem, perhaps we could refer them to counseling. If there's an abuse problem, we can refer them to a shelter or to someone who could give them help. We don't have to fix it. That's not our job. But often the client really has no expectations that we are going to fix anything. They just want a sympathetic listener, somebody who is non-judgmental, who will hear them. Once the hour's over, we give our home care advice, we rebook the client, and when the client goes out the door, they take their problems with them. This is the client's life. They have to live it. They have to deal with their problems. It's not the therapist's life. So that's something that we need to practice as therapists, that when the client goes out the door, we need to let go of everything that we've heard. In our next chapter, I'm going to talk about some practical exercises for dealing with this. In chapter 1, we talked about what clients say when they're on the table, their conversation that can be stressful for the therapist. In this chapter, I'm going to talk about clients who don't say anything or don't say much, and still, it's still stressful for us as therapists. So some clients may be lying on the table, not saying a word, and yet somehow the therapist feels stressed. Now, why does that happen? The client may be very ill. The client may be in a lot of pain. And we know that because we've taken a health history and we know what their problems are. So if that happens, if a client has told me about these problems, when I go into the room, I'm very conscious that this is a person who's in a lot of pain. I'm being very careful. I'm being very mindful not to hurt them. And that puts stress on me as a therapist. So in that way, even though the client's not talking about their problems and their pain, I may still have stress due to the situation. Now, some people may not tell me anything about their pain, and yet somehow being in the room with them feels stressful. We don't really know why that happens. Is it the tension in their body? Is it their actual lack of communication? Some therapists believe that there are clients who emit negative energy. I don't know if that's true. But for one reason or another, some people do seem to demand a lot of emotional energy from us. I've heard some therapists even describe people like this as energy vampires, people who suck your energy out. I'm mentioning it just to say that I don't like that term. It implies some kind of an evil intent, that the client is trying to harm the therapist in some way. And I'm really sure that they're not. People are there for their own needs. If we allow ourselves to be depleted by the client's needs, then we have to find a way of changing that, of not allowing that to happen. And now I'm going to demonstrate some actual exercises that will help with that. For our exercise, to prevent any negativity or any painful emotions that the client might have for affecting me, I do some grounding exercise before I go into the room. So I'm standing outside my treatment room door. The first thing is to feel grounded. That means in connection with the earth. Now, of course, this isn't really the earth. This is a cement floor with carpeting over it. But it's a meditation exercise. So the first thing I'm going to do is take a deep breath. Breathing is important in this exercise. Take a deep breath and feel myself grounded, connected with the earth. Then there are different ways of doing this, and each of us has to find what works for us. I'm going to suggest a meditation exercise, and you can alter it, tailor it to suit yourself. I'm going to visualize that I'm surrounded by a bubble of white light. You might prefer a different color, but I'm going to try it with white light. So I'm surrounded by a bubble of white light, and nothing bad, nothing negative can penetrate that bubble. I'm safe within this bubble of white light. So I take a few deep breaths outside the treatment room door. And I have a friend who actually painted the outside of her treatment room door white because it helped her to visualize being surrounded by white light. So I'm surrounded by white light, I'm grounded, I'm breathing deeply, and now I'm going to go into the treatment room. We've talked about the clients who discuss things with us, who do things that are stressful to the therapist. In chapter 4, I'm going to talk about the other side of it, about therapists whose conversation is stressful to the client and is negative for the client. We have to be careful because when we're in a room with our client, we really have that person as a captive audience for an hour. If I decide to go into the room and complain about my life for an hour, there's not a lot the client can do about it. Most people are polite. They're not likely to tell me to shut up, that they're not interested in hearing about this. They will lie there and listen to my conversation. But this may not be the best thing for them. In fact, it probably is not the best thing for them. So what do therapists talk about? Well, we all have troubles. We all have stresses in our lives. If I'm having a bad day, if I've been having an argument with my internet provider, or if my washing machine has broken and the repair person isn't coming, whatever may have happened in my life that has me stressed out. If I go into the room and spend an hour griping about this, first of all, I'm not giving my whole attention to my client's needs. I may be missing things. I may not be getting good feedback from my client about pressure and about pain. The other thing is that this is a form of what we call countertransference, that I'm using my client as a therapist. I'm looking for my client to sympathize with me, to sympathize with my problems. That's not what they're there for. This is the client's hour. They have paid for an hour of my time, and they have a right to expect my full attention. So we did some exercises in Chapter 3, and I'm going to add to that in Chapter 4 with some exercises to focus on leaving our problems outside of the treatment room. In the last chapter, I demonstrated some exercises outside the treatment room door for being grounded, for having a bubble of white light to prevent any negativity from coming from the client to me. In this chapter, I'm just going to add a little bit to that exercise. And that is, if I'm having a bad day, if I'm having problems, this exercise is going to help me to leave the problems outside the treatment room door. The treatment room is my quiet, peaceful space for the client and for me. I'm not going to bring any negativity into this room with me. A couple ways we can do it. When I wash my hands, I can let the water run down my arms, and we think of water as being cleansing, being purifying. So I let the water run down my arms and visualize that anything bad, anything negative is running away with the water down the drain and it's gone. Another physical way of imagining we're leaving things outside the door. We can wipe our hands of the problem. We can wipe our feet of the problem, as if we've stepped in something bad, but we're leaving it outside the treatment room door. It's not going to come into this peaceful space with me. And now I ground myself, I get my bubble of white light in place, and I'm ready to go into the treatment room. Now I'm in my treatment room. I'm surrounded with my bubble of white light, and I'm going to put my hands on my client. If at some point during the treatment I lose my focus and I don't feel my bubble of white light, I don't feel grounded or protected, I can take my hands off for a second and do a mental exercise and just focus on my breathing for a second, picture myself as being grounded, and get my bubble of white light back into place. We're usually told not to take our hands off the client, not to break contact. But there are always opportunities to do that. When I go, for example, from the client's back to the leg, there will be a few seconds when my hands are not in contact. That's a perfect opportunity to do it. Or when I move around the table. There are always chances to do that. It takes practice. As I said, it's an exercise, and it takes practice to be able to maintain that calm, that inner calm, throughout your whole treatment. So don't be discouraged if you do lose that focus occasionally. Just take your hands off for a second and refocus, and you're ready to go again. Now, some people work better with spoken words or words that they hear in their head rather than pictures, rather than visualizations. So a mantra, if you will, that my teacher taught me years ago was to say in my head, I will give only good, I will receive only good. Just set a mantra for your treatment. And just say that to yourself whenever you need to, whenever you feel that you're losing focus. So we all do exercises differently. Something that works well for one person doesn't work so well for another. And you need to find what works best for you, whether it's words in your head or a picture, what works best for you. There are other ways that you can word this to yourself within your own belief system. And that's the only way that we can work, within our own belief system. So if it works better for you to say, I'm being protected by the light of the universe. Or if a religious focus works better for you, if you want to say that this light that surrounds you is the light of God's love. Whatever works in your belief system is the exercise for you to use. Personalize this and make it your own. This final chapter, chapter 5, is called When Life Gets Overwhelming. In chapter 4, I talked about how we deal with the aggravations of daily life, when the washer doesn't work, when we have a fight with the computer provider, when we have issues with our kids or with our spouse. Those are the usual aggravations of daily life. But there are times in our life when something really catastrophic happens. Something much more serious. For example, the death of someone in the family, a marriage or a relationship breakup. That's a whole lot more than having a fight with the computer provider. And if you practice for a long time, as I have, things happen. I've been in practice right now for almost 30 years. Well, in 30 years in a person's life, overwhelming things do happen. That's just part of life. So we have to think about how we deal with that. We really, really should not be taking these serious emotional issues into the treatment room. We shouldn't be imposing them on our clients. But can we do that? Can we leave those things outside the treatment room? Well, I gave you exercises to do in chapters 3 and 4. If you've been practicing the exercises diligently, you may be able to do it. A mental or emotional exercise is just like a physical exercise. When you first try it, you're not very good at it. You're not very strong. The first time I ever did a push-up, for example, it was really difficult, and I was lucky if I could do one push-up. With years of practice, I can do a lot more push-ups. We get stronger at anything if we practice. So if you have been practicing your emotional exercises and you've become really strong with them, you may in fact be able to continue practicing even when something catastrophic happens in your life. You may be able to leave it outside the treatment room door. The two major things that have happened in my life in my 30 years of practice was the death of my mother and a marital breakup. And yes, I was able to keep practicing right through those very emotionally trying times. Not everyone can do it. It's not an expectation that you have to be able to do it, that you're proving something if you can continue practicing. We're all different. We all have our different strengths. I think what's very important here is that you are honest with yourself. If you know that you're emotionally fragile and that you are not going to be able to leave these feelings and these emotions outside the treatment room door, then you really need to take some time, to cancel your appointments for a while and take some time. It would not be appropriate and it would not be helpful to the client at all if I go in to do a treatment and halfway through the treatment I burst into tears. That really would put the client in a position of having to comfort me, of having to be my therapist. And that's not what I want. That's not what I want for them. So we have to be honest with ourselves. We need to take the time that we need to recover when something overwhelming happens. and then to use the strength that we have gained from our exercises to be able to go into the treatment room and leave our troubles outside the treatment room door.